So what really happens with skin cancer in most cases is people that they're outside, they're going to their job or they're gardening or whatever they're doing for most of their adult life, and then they retire. They get the dermatologist sees them and says you better stay out of the sun, and then they start staying out of the sun entirely or using sunblock, and then they start getting skin cancers coming through, and the dermatologist rightly says this is from your radiation burden, which is true. But the problem is, by staying out of the sun, they have stopped the system that nature designed to help prevent skin cancer, and that is the recent discovery that vitamin D is activated directly in the skin, and activated vitamin D goes directly to the genes in the skin and helps prevent the type of abnormalities that ultraviolet light causes. So it's very interesting that yes, the sun does increase genetic damage in the skin and can cause cancer, but nature has designed a system to obviate that. But when you stay out of the sun entirely, your skin is not making any activated vitamin D. But the truth is that you make all the vitamin D you're going to make in a very short period of time. The really important fact about vitamin D, besides it's a steroid hormone that goes directly to genes, and besides the fact that you make 20,000 units in the summertime in your bathing suit, the other fact is how quickly it's made. It's made long before your skin burns. So I think the conservative thing to do, like you pointed out, Dr. McCullough, in the northern latitudes, I mean, you can't go out, you can't make any vitamin D for months at a time. In fact, the vitamin D winter, in Canada is up to 6 months long, and in northern United States it's a long time. So you have to take supplements, and there's no other choice other than a suntan booth or a sunbed or a vitamin D producing light. But supplements is what many people choose. And also, what about African Americans? Sure. The more melanin you have in your skin, the longer it takes. So do African Americans have an hour every day that they can lie out and sunbathe? And many people don't have that kind of time. So it's also important to realize that this. Some people have been saying that all you need is to have your face and your arms exposed, and you make all the vitamin D you'll need. That's just simply not true. Not only will you not make all that you need for the summer, you won't even make any to store for the winter. If you're going to make vitamin D in your skin, you want to expose as much skin as possible around the time of day where the sun is highest in the sky, but just do it for only a few minutes, 10, 15, 20 minutes. Most people end up taking vitamin D supplements.
Do you know when you get any evidence or review any literature when you're exposing your skin to the sunshine, and then you would dive into the pool or into the ocean or a lake? Does that, because it is a steroid hormone, as you mentioned, and it's relatively oil soluble, producing the skin, does that wash off when you go in the water?
There's no study that I'm aware of looking at just water, but there are some studies that looked at soap. And it turns out if you go sunbathe and then you get in the shower and wash your body with soap, you're washing off a lot of the vitamin D. And it's variable how much you're washing off. But some of the studies show you're washing off up to 80 or 90% of the vitamin D. So it is very, very interesting.
So that's a nice little caveat if you're sunbathing or go to the suntanning parlor in the winter and then if you shower with soap and water, the soap is a good likelihood that you're going to destroy most of the benefit that you've just created.